Hello everyone, I'm Ms. Weng Aguilar Laughlin, franchise owner of Mutianang Pilipinas, Pampanga, and a loyal client of CSA Medical Aesthetics. To give a brief history of my youthful looking face, about 2 years ago, I started doing a Cog Thread Lift on my face and on my nose. And I also did under eye treatment. And all those procedures are non-surgical. Of course, when we say non-surgical, there's a little bit pain, but tolerable pain and no downtime. And all those procedures are done only here at CSA Medical Aesthetics, only by my trusted aesthetic physician, none other than Dr. Contessa Salvador Alapag. And you can see the instant effect. And today, I will be doing brow lift procedure. And don't forget to subscribe and click the notification bell for more updates.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Ma'am Weng Laughlin.
Hello everyone, I'm back.
6 months ago, we did a procedure, a full beautification procedure where we used Botox, lip filler, kohl shine, and some Cog Thread Lifting the traditional way. Now, of course, we've been discussing a while ago about doing this maintenance treatment. And I mentioned to Ma'am Weng, maintenance is the key.
Yes.
So we have already achieved that being youthful. Of course, aging is continuous. So we have to do something about it. Like you've done a treatment a year ago or 6 months ago. So there will still be some kinds of maintenance that we need to do in our center. Right, Ma'am Weng?
Yes.
Kamusta ka naman? How was the journey?
Siyempre, as many people is telling me, Doc, you know, I look daw 40 years old. Oh, wow.
Yes. Parang 40-ish na nga si Ma'am Weng.
Talaga?
I was
So,
asking
of
her
course,
kasi every time I see you, I keep on asking, Ma'am Weng, how young are
Yes.
you? I thought, yun nga, ganong age. But then she told me, yun na nga ba today?
Yan, Doc, every time I post, you know, siguro nababasa din sa mga comment. Yun na nga yun. Isa lang ang sinasabi nila, I look younger than my age.
Kaya
diba?
nga
And
eh.
of course, thanks to CSA.
And younger, and at the same time, beautiful.
Beautiful.
Right? Beautiful at this age of ours. So like, as a review, like a year ago, we did the so-called brow lifting, fox eye thread lifting. So we will be doing that procedure today again to also lift this part here, like the medial brow, the part of the arch, and the tail of the brow. So we want the eyes opened and at the same time, kind of immortalize the eyes or give that bright eyes look, okay? And the method that I will be applying today is a combination of the traditional and the reversed method. And of course, let's not forget the mid-face and the lower face. So we still want to reposition this saggy cheek area here and the jowls here. So as time passes by, they will still kind of, with the pull of gravity, they tend to descend. So we wanna, again, lift that in a reverse method. Because 6 months ago, we did the traditional method. So we'll combine it with the reverse method.
Parang reverse method.
Yes, to target still this nasolabial area here and this labiomandibular area and the jowl area there. And then, as a review, we did lip filler about 5 months ago. So this part here, I still see the effect of that lip enhancement. Because you wanted only something subtle.
Subtle, yeah.
Not a drastic one, not the fish lips, right? So you want still natural and you will still feel okay about yourself, not feeling awkward or alien-like. Yan. So at our age, yan, above 50s na kami ni Ma'am Weng eh. Yan. We just want to have a natural look, refreshed look, beautiful at our age. It's kind of like appropriate at our age. Okay?
Yes,
so we want to achieve still treatment with an effect, and of course, very safe. And over time, it's not giving you like troubles, like, oh, I have this material here, it's giving me this sensation that this material is having this too much of volume on my face, because right now we've been hearing about overfilled syndrome, like a lot of people don't want dermal filler anymore because they feel like their face is becoming bigger or puffier. So what we want to do is we want to do procedures that will, of course, on the long term, it is still safe and will still make you look natural. Okay? So we'll be showing the treatment when we return. And we're back, so we're doing a treatment for Ma'am Weng here. We'll be applying again our Cog Thread Lifting. So we'll work on the upper third, the middle third, and the lower third. So before any procedure, we have to numb the area. So we'll be doing injection of our tumescent anesthesia. So I'll be starting on the upper third. So disinfect, please. So a while ago, they did cleanse her skin. They put a numbing cream, a topical anesthesia, and then right now I'll be just injecting some lidocaine here. So I'll still be applying the so-called Fox Eye Thread Lift. So this is a reverse method of Cog Thread Lifting. Instead of having an entry point at the hairline area, the entry point will be at the lower part of this part of this brow region here, or the temple region here, or near the lateral canthal area. So I'm just injecting my lidocaine first. So series of our anesthesia here. So I'm now at the tail of the brow here. Now for my forehead region, what I'm gonna do is still apply my traditional Cog Thread Lifting here. So my entry point will be at the near the frontal hairline here. Okay. And actually, you can also do the reverse method here, whereby your entry points will be this inferior part of your eyebrow here. But for now, I'll still be doing the traditional method, whereby like you can draw a line, medial brow, to the tail of the brow and make it like a triangle shape here. So you have an entry point here. And then just have your lidocaine be injected in the kind of like beneath the skin surface, and just make a pattern here. So my vector is like an inverted V here. Then we'll also be working on the midline area. I want to pull the medial brow there. I'm going to inject a lidocaine also here. So just follow a kind of like inverted V pattern there. So also make your line here, a line there. So I'll be starting with my upper third. So take note, for our doctors doing this kind of injection, be careful. This kind of injection, be careful with the so-called the supraorbital and the supratrochlear vessels there. So I'll start with an entry point here. I'll be using a Royal Cog thread here. It's double cog type. The cannula is 60M, and the length of the thread, as you can notice, is it's double cog. It's like a spiral cog with a longer thread, PDO thread. Okay, so just insert like that, and then a second one like this. So you can make your pattern, you can draw your pattern. So your line will be like diagonal here, and it's gonna be toward the temple region here, and it's oblique. So I have my entry point and my end point there. So this is now the third one. Then after this, I'll do the inverted V for the right frontalis area here. So I'm just gonna insert up to the scalp region. And there you go. And then just continuing on with this one here. So I have my entry point here. Can I have lidocaine again, please? So just re-injecting my anesthesia for the entry point here. There you go. So this kind of treatment is a non-surgical approach for lifting and repositioning ptotic tissue. So I want to reach the medial brow there to lift the medial portion. Okay, just go subgalia, so lidocaine again. So the plane of insertion of this thread will be in a plane whereby you have to avoid some of the neurovascular structures. So like here, I'm going towards this so-called near the supratrochlear area there. So I'm going to reposition it again and re-glide it. So Ma'am Weng already had this procedure in the past, so it's just a maintenance for her. Okay,
That's like a year ago, no?
Yeah, it's like a year ago already. And I'm gonna go with the second one for this lateral frontal area or lateral forehead area on the right side. So having my entry point again here, and I'm just gonna pull again the tail of the brow. So just glide it in that gliding plane there. So some resistance is normal. Then just lidocaine again. So it's normal that you have this bumps on your skin because we injected a lot of lidocaine. So you have the reverse method, you have the traditional method, so you can just glide towards the tail area there. And then once you have that end point, then you pull it out. So we'll just cut these regions. We'll be starting on this part here. And then we'll just cut on this exposed threads. So I can still do the center of the forehead there. Center forehead there. So later on, we'll just do pressure on these parts here. So again, the inverted V. So this is my entry point there. So we'll do the second one in a little while. So some resistance, it's normal because we already had procedures before, so we're expecting some resistance because of those fibrotic tissues there. Then we'll proceed with the second one. So this is reinforcement of what we've done a year ago, and entry point again here, and glide just towards the middle, the opposite medial brow there. Then we're going to proceed to the right mid-face area. They're cutting this. So this is a double stranded treatment. So like about 6 months ago, we did the traditional lifting from here to this jowl area here. So what I'm gonna do right now is to do a reverse technique. So my entry point will be here and then towards this posterior zygomatic area. So it's gonna also be like in a kind of like an inverted V pattern again. So we have a lidocaine here, then we'll do a lidocaine here. I'm using a long needle here and just inject the lidocaine into the path of your thread. Okay, so we can use a lot of tumescent anesthesia. So this is going to be my entry point. So it's kind of like an oblique vector because you want to also lift this ptotic tissues here. So Ma'am Weng is doing some weight management, so reducing the weight can also help reduce some of the fats here in the mid-face area. We have a lot of malar fat pads here, so we also want to reduce that. So we're doing this. So I'm using also my royal cog thread here, a double cog thread, to push these ptotic tissues here. There. And another one here. So we'll be targeting the kind of like the fixing point is this part. We want to fix it on onto the posterior zygomatic arch. So if you want to add, you can still add in the center part of that one. And then let's do the lower third. Let's lift the lower third there. So we expect some bleeding because we've been injecting. Okay, and then the lower third, now I'll be doing for the lower third a longer multiple bidirectional type of cog thread. So I want to lift this toward the posterior part of the face, towards the preauricular region. So just continuing with this. So before you can inject your cog thread, you have to really numb the area first to get rid of some pain or discomfort there. So we're doing the lower third part. So again, I'm using a long needle. So I'm gonna be targeting this part of the preauricular region there. So just gonna be adding some more lidocaine. And then let's do the entry point there. So first one is here, and a long multiple bidirectional. And then we'll do the last one for this side here. So towards your preauricular region, and a last one here. So just to pull this labiomandibular fold here. So take note, there's gonna be a lot of bleeding because of needle injected. So this is the last one here. So okay, so then let's proceed to our opposite side after cutting this area. So we have done our left side, then we'll show the result to Ma'am Weng when we return. And we're back, so let's show the result to Ma'am Weng. Ma'am Weng, here's our mirror for you to check
mirror
on the result
wow.
of the Cog Thread Lifting that we have done. It's
instant, ne, Doc?
yeah, it's a procedure that we've done in only. You timed it. You said
like
15 minutes.
Okay. Yes, 15 minutes procedure.
So, Cog Thread Lifting,
very fast procedure.
Upper, mid-face, and lower face, and most of it was on the reverse method. So, right now we're doing this combination methods, the traditional or the classic one and the reverse one. Well, the goal is to, of course, we want to lift those ptotic or saggy tissues, bring them up. So we're lifting from above, and we're also pushing from the lower part of the face. So, how are you, Ma'am Weng?
Yes, ito na. Another episode na maybe in instant effect.
Yeah.
Siyempre, as times goes by,
yes,
mas nakikita mo po yung effect. And it's a very short procedure, tolerable pain. Siyempre, may pain, pero you can tolerate it.
Correct.
And yun. Exactly.
It's a very tolerable discomfort.
Yes.
And we injected lidocaine there to numb the area. You can do still nerve block to further numb the area, okay? So on the upper third, I used those double cog threads, the royal cog thread. So I did the lifting on the tail of the brow, the corner of the eye, and also on the eyebrow part to lift those ptotic eyebrows, to reposition them up to this upper part of the forehead region, okay? So in this center part, I did the classic method whereby we have these entry points on the hairline. I did also, I added the one for the medial brow. We did also the reverse thread lifting, reverse cog thread lift there to really have that saggy eyebrow here be lifted.
Yes, that's one
okay?
of my problems talaga
Right.
to. Kasi nagsasag na yung
Upper
brows,
eyelid,
yes.
eyebrow, yan. And
Yung
you were thinking of
eyelid,
doing
eyelid.
some surgical for that one.
Yes,
So try
so
this
try ko
method
muna
first,
ito.
the
Yes.
non-surgical approach. It's gonna
Yes.
really lift and open your eyes. And then we did the mid-face also because 6 months ago, I did already the cog lifting traditional method. So I have an entry point on the nasolabial area there, and it's like an inverted V as well here. And you can still add some more cog threads there, and on the lower part, the jowl part, it's the same thing, like entry points here, and towards the preauricular region, it's like the inverted V as well. So there's still some soft tissue swelling right now because we injected a lot of lidocaine solutions or
Yes.
tumescent anesthesia, but we
Parang
still give
inflamed,
time.
parang,
Exactly, we give time for the healing. The recovery will be showing the results like days later. Okay, we'll be sharing with them. Mom Wing will share with us. Plus, of course, you'll be having a follow-up again.
Yes,
So we're actually preparing for a big event, a wedding,
A wedding?
of her daughter. Okay, so we're
Yes.
preparing for that event. It's gonna be how many months from now?
maybe 6 months from now.
Yeah, like 6
5
months, or
after.
5 months from now. And this is a good treatment
Just
to
in
do.
time, yeah. Just
Yes.
in time.
So that during that big event of your daughter, you're the prettiest mom in the world, right?
should
Okay.
I?
We're not getting any younger. It's reversing the aging process. So if there's anything that's saggy or ptotic or going downwards, we can reposition it upwards, okay? So the descent of the aging, we can do something about it. And plus improve the skin quality, skin texture. We have our regenerative medicine. We were doing shine on you, collagen injections. So we'll still have some treatments for that one. During her follow-ups, we'll do boosting of her lips. We'll be treating the under eye area. We'll be doing some, again, Botox there prior to the big event and improve the skin condition, the skin texture with our shine and some of our regenerative molecules. Todo na to, Ma'am Weng.
Yes, exactly.
Yeah, we'll follow the series of, your journey to achieving
as
forever
they-
young.
Yes,
Right,
Doc.
yeah.
Makikita naman nila, Doc, my previous pictures and you can tell the difference. you know.
Right.
Subtle change, pero it's beautiful.
There you
know.
go. You
and
can
people are asking
yeah.
me, Doc, why I do it.
Yeah, why
And
do you do it?
My answer is very simple. Why not?
Okay, I like that answer.
Especially
Why
with
not?
Dr.
Bakit naman,
Contessa.
nga
Yes,
naman, bakit
exactly.
hindi, right?
Exactly,
Yeah.
as simple as that.
Yeah.
You know? It's
Taking-
it's an investment for yourself.
Yeah,
Di ba,
taking good
Doc?
care of yourself as well.
Exactly. Take care. Yeah.
So, what we're doing is a reversal of aging, so we can do it in a non-surgical way, more natural looking, and of course, it's gonna make you feel more confident about yourself. And this is self-care, self-love. There's nothing wrong with that. And we were blessed with this physical appearances, so why not, give the best while we're at this age. Okay. Thank you so much, Ma'am Weng. Okay.
Follow us, yung of course,
Yun.
Channel Pilipinas Pampanga. So, yun po. Follow us on our page.
Yeah, thank you so much. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our previous episodes of Ma'am Weng so you can
Yes.
see her transformation there.
Exactly.
And watch all our videos, our YouTube channel, Contessa Salvador. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.